And welcome to this Dialogue Web Extra. I'm Marcia Franklin. I'm talking with my guests here about vaccination, immunization issues. And we want to talk a little bit longer after the regular program about increasing Idaho's rate of vaccination. Right now it's 60.4%. We're second to last behind Montana. We're actually 50 out of 51 if you include the District of Columbia. And I want to get all of your thoughts on this issue. What can be done? There's fear, there's cost, there's any number of things that feed into this. I'll just go around and ask for your thoughts on how we can increase our immunization rate.
Well, I would say from our perspective, we know that parents trust the physicians. They trust their medical provider. And so we see that as the major resource for a parent. And so from our perspective, it's getting the information out to the physicians, out to the medical community, so that they can then in turn answer parents' questions and their concerns.
But people hear things on the internet or see things on the internet now that they didn't 20, 30 years ago. I mean, I was prescribed a medication recently and I went and looked it up on the internet. Oh my gosh, I called my doctor. I'm like, I don't want to take this. It looks so scary. Because, everybody had written in about adverse side effects. So the internet has lots of stories about bad reactions to vaccines.
It's a very powerful tool, but it can also be used in the appropriate ways as well. I mean, it's also a great resource to see how many diseases we can prevent, the reduction throughout the entire world in terms of vaccine preventable diseases. But again, I would go back to saying, I think from our perspective, we've got to get that information to the physicians so that when moms and dads and guardians show up and they are freaked out because they've read something on the internet, that they can then say with absolute confidence, this is not true and this is why, and be able to address those concerns.
Russell Duke from Central District Health Department, I've been thinking about this all week, obviously, the topic, and do you think we could see kind of an ironic situation where the uninsured, and in some cases less educated population gets vaccinated more than the insured patient who's out there trolling on the internet and reading a lot of things, but the other person comes in, it's free, they come in, they do it. I mean, do you see any correlation there, or?
I don't know that would actually ever happen as far as for you're suggesting that the insured population would have lower immunization rates than the uninsured?
Well, certainly if the Vaccine for Children's program continues along the course it's been on, where we don't provide assistance to people with insurance, you could almost see that people with insurance have lower vaccination rates than people who are uninsured.
Well, I think that's certainly a possibility. I think when we look at data in the state of Idaho, one of the lower immunization rate populations is Medicaid, children that are insured by Medicaid. So they have basically free health care.
And they're still not getting
free vaccine. They're part of the Vaccine for Children program, and they're still not getting immunized.
Yeah,
so I don't know that the insurance situation that we're struggling with now in terms of how to fund the program long term through universal or some type of contribution from the insurance companies for their beneficiaries. So I don't know that that'd be the case. I think that we have policy options that I mentioned earlier as far as bringing our administrative code up to CDC's recommended schedule, which is not the case today, and I think that's absolutely critical as a starting point. Now, that's not the solution. I think the practice side of it, which I think Dr. Patterson will talk about, is really critical too, is not to miss opportunities. When those kids come in at 12 months, 13 months, 14 months, 15 months, even for sick visits, they should have their immunization records reviewed, and that's the time when the kids need to be immunized.
Before we talk to Dr. Patterson, so you're saying if we come up to CDC guidelines, we'd have more shots?
Actually, today, what we have is there's a couple of shots that are recommended by the Centers for Disease Control. That's part of our low rate. Varicella, for example, or the chickenpox vaccine is not required for child care or for schools. Now, there's only one other state in the United States, and that's Wyoming, that doesn't mandate it. And again, I'm not suggesting mandates are the be-all and end-all, but it's certainly a starting point to say, this is what the state of Idaho expects for our children. Now, as we talked earlier, families have the option to opt out, check a box, and out the door they go. But at least if we set the policy at that level, then
I see what you're saying. So part of our low rate comes from the fact that we don't require certain things like chickenpox shot to begin with, so that
And I don't know if I'd say that's the reason for our low rate, but I think if we set the standard a little bit higher and say, we expect, as Dr. Patterson mentioned, there's a number of children in Idaho die every year from chickenpox, and we have this vaccine that will prevent that. So to not require that from a public health policy just doesn't make sense to me.
And before I talk, the eastern part of the country, including the South, has a much higher rate of vaccination. Do we know why? Is it people in the West are more against vaccines?
Well, I guess maybe to go along with what Russ was just saying, they do have much stricter immunization requirements. I think that...
And stricter opt-out, requirements in terms of if you want to, defer or refuse immunizations, it is much more difficult in the eastern states than it is, for instance, in our state.
And do you see the legislature changing that, adding more shots?
That's a good question. I don't know the answer to that. Obviously, that's something the subcommittee will look at, and obviously we ought to consider it. Most of us in the legislature are pretty new to the whole discussion. Until this whole funding issue came up, and the uninsured population was going to have the vaccines and the insured population was not, all of a sudden, I think it's, as I agree with Rebecca, it's kind of brought the issue to the forefront. I'll say for myself, personally, I was not that involved in that decision. It was not a healthcare task force issue before, and I've been the chairman of that committee for some time, and it hadn't really been a budget issue before. I want to go back to the question that you asked Russ, though. Most parents who are buying insurance on their kids, on themselves and on their kids, they want to do the right thing by their kids. I received a call from a lady down in Burley who was pretty frustrated over this whole change. She went into her physician was keeping 2 stocks like he was supposed to, except he did not have it on the pneumococcal vaccine. And so her child was able to get the vaccines on everything but pneumococcal. The doctor had the pneumococcal vaccine for the uninsured, but could not give it to that was insured. And you want to talk about a frustrated mother. Most of those mothers, and a little bit our whole system, we want our kids taken care of, and they've done the right thing by buying insurance. So I would really think they'd want to do whatever we need to do to fix it.
And you had a patient just like that as well who was upset that there wasn't vaccine available for her in the insured population.
So it really is a problem that we saw, but we had very strong opinions that if this is what my child needs, this is what we'll do. It doesn't matter what it costs. So we had that end of the spectrum. To the other end, well, we can't do any shots today until we find out whether it's going to cost us or not. And then we had the middle ground where people were menu picking. And so the reason that physician probably didn't have pneumococcal vaccine is it's very expensive. And so that would be my guess. So in between both extremes, you've got menu picking, and if you're going to menu pick, it's very difficult because we have pertussis circulating in the community right now. Pneumococcal disease could come back very easily. Rotaviral disease could come back very easily. The only vaccine preventable disease we have eradicated is smallpox. So if you want to forego the smallpox vaccine, you're safe to do that.
And as a physician,
but the other ones, it's still possible to have a major recurrence of disease.
And as a physician, you see the best way to raise Idaho's immunization rate as these opportunities that you get when the child is in the doctor's office.
So if I have one statement I can make about how to do it, it's to change culture of immunization so that we're not having immunizations at the bottom of our priority, but at the top of our priority, where we talk about immunizations every day at breakfast, at the park, in the doctor's office, at the health districts, at the immunization program, so that vaccines are just part of our lives. We realize the benefits. We need to do education about the diseases that exist. The Canyon Area Immunization Coalition has a very nice exhibit, an iron lung. People don't know that an iron lung used to save people with polio. So, it's amazing to see people's reaction to, wow, that disease really affected people. So we don't see the disease. So we need to educate both the public about the vaccines, the safety data that we have, try to clarify the data that looks the other way, that would, support the fear of vaccines. I'm not saying to do cover-ups, but we've spent very specific energies looking at, does this vaccine cause autism? Does thimerosal cause autism? And we can't find very good data that says, yes, there's a link. So we need to increase the awareness, increase missed opportunities. So for instance, in my practice, my nurses and my aides have sore hands at the end of the day because they immunized most of the kids that came in, where only maybe 40 to 60% of those visits were well visits, the other part being sick visits. But when appropriate, we look at every opportunity to immunize a child. We look at the siblings sitting over in their corner gloating because it's not their day to have shots. And we say, let's pull up his chart, and we catch a child that needs another hepatitis A or a second chickenpox vaccine. So missed opportunities, changing the culture of immunization, working on reimbursement so that physicians, if we do end up in a private purchase setting, have the confidence that their resources expended over a 60 to 90 day period for reimbursement are going to be reimbursed. It's a matter of multiple problems. If you look at the states that are VFC only, lots of them have way higher rates, and insurance and families and public health are all working together to make those rates what they are. And so I guess I would just say we can only go up from here. So it looks really good for us.
Well said. Thank you very much. You've been listening to 4 different individuals talk about the issue of immunizations. If you'd like to watch the whole program, it's at our website at idahoptv.org.